Good afternoon and welcome. Thank you for joining us today. My name is Sean Evans. I'm with the Meridian Chamber of Commerce, and the Meridian Chamber, in partnership with the City of Meridian, Central District Health, Crush the Curve Idaho, and numerous partner organizations and individuals are proud to share with you a program that will help assist Meridian businesses as they reopen for business. Our campaign is designed to educate businesses on the basic guidelines to reopen on the Central District Health and CDC guidelines. It will allow businesses to demonstrate to the public that they're doing so in a manner that will keep Meridian healthy and open for business. Online and speaking with us today are just a few of the partners and organizations that have helped us develop this program to support the Meridian business community, as well as local businesses leading in best practices when it comes to safely reopening. Today's speakers include Tyler Jordan, Program Manager with Central District Health, Amy Stahl with Salser Health and representing Crush the Curve Idaho. And we also have Kelly Parziali with Marketing Director of SERPRO joining us today. We will open this up for questions after everyone has an opportunity with their presentations. You can enter your questions at any time during the presentation in the question window. The premise behind our campaign was getting businesses back open and restarting our economy. And this is why our group was started. We initially pursued efforts to get everyone open as early as possible, but we also saw the bigger issue of businesses might face when reopening amidst the COVID-19 crisis. Will the public return to the stores' establishments when they reopen? We are contacted daily by our business members on how the governor's plan applies to my business. When can I actually open? And what guidelines does my business need to follow? While the Meridian Chamber of Commerce is not an authority on the plan or the recommended guidelines, we are here to help Meridian businesses understand them better. The last thing that we want to happen to our local businesses is that they go to the effort and expense to open, bring back employees, restock their shelves, and the public, their consumers, not visit their establishment out of the fear or concern for their safety. The Central District Health and CDC have developed some guidelines to reduce your risk when out in public. And if businesses can follow these guidelines as they reopen and demonstrate to the public that they are serious about the public safety and health, then that will build the consumer confidence necessary to restart our economy. The Meridian Chamber of Commerce has launched Keep Meridian Healthy and Open for Business to help our businesses build that consumer confidence. As businesses open according to the governor's 4-stage Idaho Rebounds program, we will assist Meridian businesses by conducting industry-specific webinars like this one that will provide information from Central District Health and CDC on the basic guidelines for that industry. The webinars also feature local business leaders that have taken even further steps to ensure that they're reopening in a safe and responsible way. After businesses participate in the webinar for their industry, they'll be provided free of charge collateral materials that they can display in their store that recognizes them as participating in the Keep Meridian Healthy and Open for Business campaign. These materials include door stickers that they can put up so that the public sees before they even enter that they are taking the safety and health seriously. It includes in-store posters that they can put up that demonstrates some of the practices that they're doing in order to keep the environment healthy and safe. It also includes some social media materials that we provide so that they can promote that they're doing these things and are part of the campaign. And it includes inclusion on our website and our marketing campaign for those businesses that are participating and taking the extra measures to make everyone feel safe and healthy. Some of the webinars that we're doing this week are what you see on the screen here, and more webinars are available on our website. Our program goes beyond what some other communities are doing by just creating the listing. We're helping them understand what it means for their business and sharing best practices from other industry-specific leaders. These guidelines are not a one-size-fits-all solution for every business. We don't know what we don't know. The industry-specific webinars seek to educate beyond a sheet of written guidelines, educating businesses on the additional protocols they can implement for their specific type of business. To be in compliance with the governor's 4-stage plan, Businesses will only be provided the collateral material when their business is scheduled to open, according to the plan. And also, as a follow-up after opening, the participating businesses will be encouraged to answer surveys from the Meridian Chamber on how their opening is going and the sentiments from their patrons returning to the stores and businesses. This will assist us in phase 2 of our program as we build out a business revitalization team to support Meridian businesses. Please look to keepmeridianhealthy.org for more information and a schedule of the industry-specific webinars, and watch replays of previous webinars. With that, I'd like to turn it over to Tyler Jordan with the Central District Health to share with you some guidelines for our corporate offices and home services businesses out there as they are reopening today. Tyler?
Hello, everyone. So first, I want to touch base on the in-home services. And some of the guidelines that we kind of want to see is just to make sure that every business and every employee knows an employee illness policy. We want to make sure that that gets communicated and they understand completely, and just make sure that they don't work, even if it's as simple as just a headache. Some of those are policies put in place, as well as when you go into home services, we do recommend that, or when you go into homes, to wear a mask as well as gloves. Now, that being said, when you come out of the house, when you're done with all the services, we do recommend that you throw away the gloves, because the virus can be attached to the gloves. So we do recommend a one-time use, as well as providing some type of hand sanitizer for the employee. If not, maybe if they don't have, obviously, hand washing available, we do have recommendations for sanitizer that has a 60% alcohol solution available for employees. We also do recommend basically, I mean, going back to the mask, we want to make sure that cloth masks are the ones that are being used. You can use an N95 as well, or really anything now that that you can get available, but we do recommend a cloth mask. I also want to touch base on the call centers, maybe business centers. Depending on the size of the facility, that will be when they are released back to go to work. It could range from stage 2 to stage 4. So depending on how many your employee numbers. But what we recommend is once you guys start implementing and bringing employees back, that we recommend waves. So not everyone comes back all at once, where they just kind of get brought in and just have a mass bunch of people. So bring employees back in waves. If everyone sits at a desk, we recommend spreading each desk out 6 feet, or every other desk if possible, or every other workstation if possible, as well as if it's not necessarily a designated desk, that you guys make everything designated so there's no sharing of workstations, so that way only one person uses it for the foreseeable future. We do recommend that staff break rooms maybe only have a few people in them at a time, or just deem them not usable at this time. So that way it stops people from congregating. Too many people, over 10 people or something like that, won't be necessarily something that we recommend, as well as making sure that the facility cleaning crew is cleaning and sanitizing all the high traffic areas. So doors going in and out of the facility, doors going in and out of, break rooms where people travel frequently, bathrooms, and just make sure that they are wiping down every single day the workstations as well, and going over those as frequently as possible. Depending on your operation, it's going to be very different, but we do recommend doing it very frequently. The high traffic areas, as far as doorknobs, stuff like that, we do recommend every hour, especially with the amount of people that could be coming back. We also do recommend, when you say work in shifts essentially. So if you are a very large facility, maybe changing up shifts for people. So one day they come in, one day they don't, kind of mixing it up. So that way you can have more employees come back, but they're going to be working from telecommuting as well every so many days. So that's going to be kind of dependent on your guys' facility. As well as just making sure they understand the employee illness policy and making sure that they understand how to interpret it and then relay that information to their supervisor and make sure that everyone is well known of how that needs to go. And then just making sure, have someone or multiple people making sure that social distancing is being adhered even outside of the building. We don't want people going out taking breaks and then having more than a certain amount of people, 10 people, 5 people just congregated, because it's kind of defeating the purpose. So we really want to make sure that those guidelines are very vigilant. You can require them to, if it's let's say a call center, business center, it is recommended that they wear a mask as well, but they don't, it's not required. That could be adopted by each facility depending on how they want to handle that, as well as glove use. They can adopt that as well, but it's not a requirement. Other than that, just make sure sanitizing all surfaces as much as possible, keeping your distance, every other table, chair, as well as in meetings. Just make sure that everyone understands kind of the social distancing, and you guys should be good to go. So that's all I have.
Thank you, Tyler. If you'd stay on for questions later, I'd appreciate it. Now, while it's not required at this time for employees to return to work, one of the most important factors that's been outlined all along is the importance of testing and tracing to slow the spread of the virus. Joining us today to talk about the availability of testing in the Treasure Valley is Amy Stahl with Salzer Health and representing Crush the Curve, Idaho. Amy, good afternoon.
Thank you very much, Sean. We really appreciate the opportunity to be part of this discussion and commend the Meridian Chamber for taking the initiative to help keep Meridian healthy and open for business. I'm speaking to you on behalf of Salzer Health because we are the medical partner in the Treasure Valley for Crush the Curve. So Salzer Health does the testing at several locations in the Treasure Valley to help combat the spread of COVID-19. I'd like to give you a little bit of an overview of what Crush the Curve is, if you're unfamiliar with it. It is a group of business leaders who quickly mobilized at the start of this pandemic to work together to source the testing kits and get ready to prepare to make tests available to as many people as possible in the Treasure Valley. The organization has subsequently grown. We also work in partnership with health care organizations in Pocatello, Idaho Falls, and Lewiston, expecting to expand also into Coeur d'Alene. The testing that we do, there are 2 tests available. One is the PCR test, which is a nasal swab test currently available at 2 Salzer urgent care locations in North and South Nampa at drive-up testing sites open from 8 to 8 daily in conjunction with our urgent cares. We also offer PCR testing at our temporary 10-mile location at 10 Mile Crossing at the intersection of 10 Mile and I-84. The results of the tests are shared with you, with the patients, through a secure portal system and are processed in conjunction with the partnership with a company out of Tennessee. The other test, which is referred to as the IgG antibody test, is a simple blood draw. It is conducted at our 10-mile location. Results are also shared on the secure patient portal, and that is a partnership with the University of Washington Virology Lab. The test results are available within 2 to 5 days, and they are a point-in-time test that indicate if you have been exposed to COVID-19 several weeks prior. It's a couple of questions that we've received. We are working with companies We've heard from over 100 interested in having employees tested. We can conduct both tests. We can work with your company to arrange for that testing. We recommend that you follow an online assessment through the crushthecurveidaho.com website. That will put you in touch directly with Salter Health employees who will work with you on the cost and enrolling your employees. Regarding the cost, there is a cost associated with these two tests. The PCR test, the current cost is $95. The antibody test is $100. We will bill insurance, but any unreimbursed costs will be borne by the company. So we welcome the opportunity to work with you, but you should be aware that there could be a cost associated with this. And with that, I'll be available for questions later. Thank you very much.
Thank you, Amy. Meridian is home to some of the most creative and successful businesses in Idaho. These webinars help bring everyone together to share what they are doing in their respective industries to reopen in a safe and healthy manner. These businesses are implementing some of the best practices and are willing to share to keep Meridian healthy and open for business. Please welcome Kelly Parziali with SERPRO here in Meridian, Star, and Eagle. Kelly?
Hi, Sean. Yeah, thanks again so much for inviting us to be part of this discussion and these calls. What the Meridian Chamber does, not just through this, but through many different facets, is very beneficial not only to organizations such as ours, but of course in the community as a whole. We're really proud to be members of this community and to be able to help out. You know, in speaking about this phased reopening plan, SERPRO Meridian has applied all of these learnings. I was sitting here nodding along to all of the things that were being said earlier by Tyler. You know, apply those learnings and practices in the direction from all of the healthcare leaders and healthcare industry folks, as well as CDC guidelines here at our business. While SERPRO is known for emergency services, water cleanup, and disasters, we are primarily a cleaning company. So all along since the first you know, concerns of COVID hit our community, we were inundated with phone calls from companies and businesses all around the valley with how to help them in getting their places disinfected and cleaned, and now especially looking to reopening. You know, they're looking to us for some guidance and some information. So I hope to be able to share a little bit of that with you today. We have years of experience in biohazard remediations, things like MRSA and norovirus cleanup. And so, you know, it's really important for people to understand about contacting a reputable, experienced company, one that knows about how to properly use PPE, one that knows the correct chemicals and the application of those chemicals, as well as dwell time of those chemicals. That's a really important factor that needs to be considered when you're going to clean and disinfect an area. One thing that concerns us is there's a lot of misinformation that gets put out there. And so following CDC EPA guidelines, you know, right now there is no cleaning product that is tested against this particular strain of coronavirus. And so it's recommended that they use hospital grade disinfectants that treat similar strains and using it in a proper application with proper dwell times. So knowing and understanding that is a really important factor for people to feel safe when they're coming back to work, and then to continue to use them once the operations in the offices are open for business. An acronym that I wanted to share with you, and I think you've got a slide you can put up, Sean. We love acronyms in our business. One that I found was the word SAFER. It was just really simple for me to wrap my mind around this acronym when it applies to your workplace. So if you'd like to use this, feel free. But you know, SAFER, S for sanitize, disinfect, clean the workplace before and after reopening. And like Taylor alluded to, it might be several times during the day. It might be daily, it might be weekly, depending on your particular establishment and how much traffic and people you see throughout the area. Assess options for reintroducing employees back to the workplace. Certainly doing shifts and limiting the number of people that come back in is really important. Follow social distancing protocols as far as meetings. We conduct our meetings very differently here now. A lot of it's done via email or phone call, and limiting the number of staff and essential staff that need to be in those meetings, as well as establish support structures for your employees who may feel sick or anxious about returning to the office. Having a flexible plan and policy for them, and then react quickly to the workplace infections and having a cleaning policy and protocol in place. You know, we at SERPRO are really happy to educate people. We're welcome phone calls, several dozen phone calls a day about how we can help businesses to reopen and stay safe in this community. I think there's a second slide. Thank you. Certified SERPRO Clean program. If you have that, it's okay if you don't. Oh, there it is. Is a defensive cleaning program for businesses to address a higher cleaning standard. So this is just some information if you're interested in learning more, we'd be happy to share that with you. You know, we have local owners, we have 40 employees that are really passionate about getting this community safe, staying safe while we're both working here in our office, keeping our health of our employees is number one, and then while we're out working in homes and businesses around the community is a very high priority. So we look forward to being able to help educate and work towards making everybody have a sense of ease in returning to work.
Kelly, thank you. What is the number one thing you're hearing from businesses as far as cleaning frequency and things that's needed? Your services can come in before they open and things like that. What are you doing to provide to businesses to clean in between those type of reopening services that you may provide, or daily or weekly services?
Mm-hmm. Yeah, so right now, a lot of these places have been empty. So we've been going in, having, doing the cleaning protocols so they have peace of mind coming back to work. But as far as ongoing plans, we're happy to be part of that conversation and talk about what that would look like. Again, it's going to be different for every location based on the number of people, if they're open to public or not, those kinds of things. You know, once an area is clean and disinfected, I'll defer to Taylor on this too, but once you introduce it to people, and if anybody has been exposed or is sick, then you need to start all over again from square one.
Remember, anyone can enter questions in the window. Someone here. Here's a question. What if my coworker tests positive? Does that mean all of the office who had contact with that person needs to go in quarantine? That may be a question back for Tyler.
Yeah, so what happens when, especially when this was first and all the cases were coming out? So what happens when we get a confirmed case? The laboratory that does the testing gets the confirmed case. They notify the health department, so specifically our epidemiology staff. Now, that being said, the epidemiology staff will contact the person that tests positive and do an investigation. And depending on what they say, they will be able to basically give the names of anyone that they came in close contact with, and then the epidemiology staff calls those individuals and interviews them, and then will determine whether or not they need to self-quarantine. So basically, come in close contact is kind of a loose term, and that's going to be based on the epidemiology staff's knowledge of what is close contact, but just because someone tests positive in the building doesn't mean that you came in close contact with that. But more than likely, if they listed you as someone that they, you know, maybe sat in a conference room with, you will get a call and then interviewed as well, and then they will discuss if you need to quarantine yourself moving forward. So it's not as simple as just yes, then you need to quarantine, but that's going to be dependent on the investigation.
Tyler, are you hearing any best practices? You know, home services ranges anywhere from someone coming in and repairing your refrigerator to, you know, your air conditioner, to someone coming in and cleaning your home and things like that. Is there anything specific that maybe the homeowner or the person inviting this person in needs to look for these businesses?
You know, what I would say is maybe if they look sick, or, you know, just for whatever reason, if maybe some person didn't put on a mask or something, just ask them to put on a mask, and just kind of make sure that they kind of keep as much of a distance as best as possible. Now that's not going to be always something that's going to be able to be doable, but if you guys are both wear masks, then that would be the best practice. But again, if they come in with, you know, the proper PPE and everything, I think the risk is very, very low, especially if they don't look ill or anything like that. I think that's going to be the first step in keeping, you know, the homeowner essentially at ease and safe, and then just make sure that those companies, which it does sound like, are well aware of, you know, the illness, and keeping people, you know, home when they need to be. If there's any type of, you know, any illness, including like almost down to a headache, they just need to be best kept home.
Okay. This may be a combination of Tyler and Kelly. You mentioned frequent cleaning. Are there recommendations as far as cleaning frequency throughout the day, or maybe office cleaning? The frequency of office cleaning and things like that, does it need to be increased other than once a week that may have already been in place prior to this?
You know, I would say that it does need to be increased more than once a week. Obviously, I touch base on the high traffic areas. We do recommend at the least once an hour for like the door handles, you know, the high traffic areas. But depending on what's doable for each, you know, business, once a week might not be enough at this time. So we don't really have, depending on what those cleaning services look like, it's kind of tough to answer, but basically I would say that, you know, once a week should be at least twice a week at this point, especially when bringing employees back for just the foreseeable future.
Kelly, anything you want to add to that?
No, I think those are really good guidelines. And like I said, every business, every office is going to want to make their own plan for what makes the most sense for them to still be able to conduct their business, but keep their employees and anyone that visits them safe, and just make those restrictions and make those plans known, post them, follow them, practice them.
Okay. I don't see any other questions right now. So with that, I'd like to thank all of you for joining us today, and please help spread the word that Meridian businesses, that we're here to help them in a safe and responsible way, and want to keep Meridian healthy and open for business. Be sure to answer the follow-up survey that we'll be sending you so that we can email you the collateral materials and get you started today with the Keep Meridian Healthy and Open for Business campaign. Thank you all for joining us today.
Thank you, Sean.
Bye-bye. Thanks, Sean.